magbuhat ta sa procedure sa Leopold's maneuver, ma'am. Okay na ba, ma'am?
Okay
And need lang po ko sa imo ang cooperation, ma'am, para dali ta mahuman.
Okay.
Okay, ma'am. Before ta mag-start sa procedure, ma'am, ako dahil si Jess Altic from Andres Bonifacio College, level 2 student. And mga tanan lang po ko sa imong name, ma'am.
Maria.
Okay, so, Ma'am Maria, pila tong edad, ma'am?
34.
Okay. And then, when imo ang birthday, ma'am?
May 25.
So for the assessment, we need to ask our patient her last menstrual period and then we need to obtain her vital signs. So sige ma'am, dayon, ano naman imo ang last menstrual period, ma'am?
December 10.
So, okay. And then, kani ma'am, ang imo ang expected delivery sa imo ang baby is September 17, ma'am. Okay. We'll proceed to the planning. We need to wash our hands thoroughly to prevent the spread of possible infection and then explain the procedure to the client. This will reduce the anxiety and enhances cooperation. Instruct the client to empty the bladder. And then, of course, we need to provide privacy to our patient and then ask to assume a dorsal recumbent position with knees bent. For the implementation, we need to drape the patient properly to prevent undue exposure of the client. And then next is to perform the first maneuver until the fourth maneuver.
Proper positioning of hands will ensure the accurate findings and also in this maneuver, determine consistency, shape, and mobility. This procedure is the most successful method to determine the direction of fetal back is facing. One hand feel the back and the opposite side will feel the knees and elbows of the fetus. Third maneuver or pollex grip will determine part of fetus at inlet and mobility. Also, it will determine if there is any engagement or any movement if there is firm or soft part. Performing fourth maneuver will determine fetal attitude and degree of fetal extension in pelvis. Note that should done only if fetus is in cephalic presentation. Measuring the height of fundus of the uterus above the symphysis pubis will determine the duration of pregnancy. Also, it will give the approximate age of gestation. To locate the fetal heart tone, we need to use a stethoscope to assess and listen for normal heart sounds and rhythms. In counting fetal heart tone, we need to count 1 full minute, and also the normal fetal heart tone is 120 beats to 160 beats per minute. After doing the fourth procedure of maneuver, we need to drape our patient back and put her in a comfortable position. Lastly, document or record findings.
So ma'am, humanata sa ato ang pag-assess, ang pagbuhat nato sa procedure sa Leopold's maneuver. And then, comfortable na ta ma'am, wala na tayo mabatian nga sakit or
Yes po.
kuan. Okay ma'am. And then, daghan kayong salamat ma'am sa cooperation. And then, ayong kabala ka mga akong nakuha nga findings is confidential ra siya ma'am. And then, kung naman kayo makita nga abnormal findings, ako ra siyang i-refer sa imong physician.
Thank you.
Thank you po ma'am.